I'm Dr. Shakti, and let's discuss about dynamic lung volumes. So this is a very important topic, especially in the recent years. A lot of questions have come from dynamic lung volumes. Okay, so it's very important that you understand these concepts. Now, first of all, when you talk about dynamic lung volume, your lung volume has some time element coming into the picture. That is what is a dynamic lung volume. So your normal volume, not static. Okay, that is something we already discussed. Now, along with your volume, a time element is also involved. So one example of that is your FVC, forced vital capacity. Okay, so what you do is you expire. Okay, uh, vital capacity means you inspire maximally and then you expire maximally, right? So when you expire maximally, expire it as forcefully and as fast as you can, and you notice that majority of the volume goes out in the first few minutes seconds, and after that the remaining just slowly trickles out. Okay, so that is your forced vital capacity. Now in that forced vital capacity, you can see this is the volume that was expired in the first second. That is what is called FEV1. FEV1. Okay, so that volume that has been expired at the end of first second. Okay, this is the volume that has been expired at the end of second. So this is another depiction of the same thing. Okay, so you inspired and from there you are expiring maximally. So here the whole thing should actually go from here to here, the value. That's it. That's why it's showing inverted. That's all. Okay. So again, you can see over here, force vital capacity, this much volume has been expired. Okay, and this is the volume that has been expired in the first second. Okay, so if you look at the ratio over here, FEV1 by FEC, the percentage comes to 80%. So 80% of the total volume has been expired in the first second. Now take a look at this. Here FEVC is this and FEV1 is shorter here. And you see that FEV1 by FEVC is 47%. Okay, you don't even have to calculate it, but just by seeing it you can understand. Okay, this is there and this is like half of it, less than half of it. Okay, so only less than 50%, 47% has been expired in the first second compared to a normal that you see over here. So this is the case when an obstruction, airway obstruction is there. So in an airway obstruction scenario, what happens is your FEV1 by FEVC percentage drops. Okay, now take a look at this. Okay, this we had already seen. Okay, so here you can see the FEV1 by FVC. So this is actually the total FVC that we see over here initially. In a restrictive condition, you can see how the FVC has reduced. Okay, so here you can see although FVC has reduced, so that is sort of a mixed thing. FVC has reduced, along with that FEV1 by FVC is also reduced 50%. Okay, so here it is like a mixed thing with more predominance for obstructive. Okay, in a pure case it might not always decrease. Here in restrictive, what you can see is that FEC is dropped. Along with that, there is no obstruction. The FEV1 by FEC ratio is still around normal or increased. Okay, so this is a restrictive condition. Another thing is peak expiratory flow rate. So when you expire forcefully, you see that the maximum rate of expiration is going to be there initially over here. So initially it goes to the peak and then it drops. This is the peak expiratory flow rate. So it comes to around 425 and slight difference in males and females. Okay, this much of liter per minute is there. Okay, so that is because afterwards it starts collapsing the airways. Okay, so another diagram where lung volume against the expiratory airflow. So this is the flow volume loop. This is the flow, this is the volume. So this is the flow volume loop or curve. Okay, it's called a curve, or if you complete it with the expiration part, it becomes the loop. Okay, so this is a normal one. In the normal one, you can see this is the residual volume. You breathe out as much as you can. Peak expiratory flow rate is this much. Breathe out as much as you can. The volume that is remaining is your residual volume. This is static lung volume. Okay, and this is the total from here. This is the total lung volume that can be there. And this is the peak expiratory flow rate. Now let's take a look at this condition. This over here. In this condition, even after maximum expiration, this much amount of volume is remaining. The residual volume is that high. A lot of air trapping is there. And you can see that this is the total lung volume. That also has increased. That is essentially because of the air trapping. Residual volume is much higher. So in a case of airway obstruction, you can see that the peak flow is also reduced. Okay, so in this scenario, peak flow is reduced, the flow rate is reduced, FEV1 by FEC, that is not that clear from this diagram. You need the other diagram. And you can see that the residual volume is increased, total lung capacity is increased. So this is a type of airway obstruction. Okay, in another scenario, you can see this is the residual volume. Residual volume is lesser. The total lung capacity is also lesser. See how less it is compared to your normal. That is because some restriction is there. Okay, either it's in lung parenchyma or outside. Okay, so that is your restrictive lung disease. Okay, so this is something you can understand from your flow volume curve. Again, all these diagrams can by itself come and questions can be asked based on this. Another important, very important concept. Okay, something about RMV. Okay, respiratory minute ventilation and alveolar ventilation. What is the difference between them? So normally the air that is taken into the lung. Okay, so the air that moves in and out of the lung, right, in a minute. So in a minute, so normally if a tidal volume comes in and out, each time you breathe, if tidal volume comes in, okay, and in a minute you breathe this many number of times, that is your respiratory rate. So that will give you the total volume that goes in or out of the lung in that 1 minute. Okay, so that is respiratory minute ventilation. Respiratory minute ventilation is tidal volume into your respiratory rate. On the other hand, you take in air, out of that, the part that actually goes into gaseous exchange, respiratory exchange, that is only this much. The remaining part, which is there over here, not in the respiratory zone. Okay, so that part is going to be your dead space. So in a minute, how much of alveolar ventilation is there? First of all, you have to know the respiratory rate into this volume. So what is this volume? Dead space is not included. So your tidal volume minus the dead space. This is your alveolar ventilation. Let's take an example to understand this. Your respiratory rate, say it is 30 and tidal volume is 200 ml. So basically what the person is doing is breathing very fast and short breaths, shallow breaths. Okay. On the other hand, the respiratory rate is lesser, 10, and taking deeper breaths. Okay, so that is the basic difference. So if you see the respiratory minute ventilation, 30 into 200, that comes to 6 liter. 10 into 600, it again comes to same. Okay, 6 liter. So that is minute ventilation. But when you look at the alveolar ventilation, here you can see that although it is 200 every breath, each breath 150 ml of your dead space is gone. So effectively only 50 is there. for alveolar ventilation. That into 30 is 1500 ml. On the other hand, over here 600 minus 150 every time, 10 times, 4500. Can you see the difference? Okay, so when a person was breathing rapidly and shallowly, you can see that the alveolar ventilation is much lesser compared to a person who's breathing deep breaths and slowly. Okay, so you see the difference over here. Okay. Okay, so another thing that we need to understand is terms like maximum mid expiratory flow rate, maximum expiratory flow rate, FEF, 2575, FEF, 200, 1200 ml and all that. Okay, so this whole expiration part, okay, in the FEC that we saw earlier, let's divide it into 4 parts. Okay, here 0% has been expired, here 100% has been expired. Okay, now 25% has been expired here, 50% has been expired here, 75% has been expired here. So when you expire, initially the air that is coming out is from the trachea and bronchi and the larger ones. Okay, then medium sized, and then towards the end what comes is your small airways. This is the concept you have to understand. So we take something in the middle. So this is for your medium sized bronchioles. Okay, so we take something 25 to 75. So that is why it's called maximum mid. You understand that? Maximum mid expiratory flow rate, MEFR. It is also called FEF, 25 to 75%. So FEF 25 to 75% also corresponds to maximum mid expiratory flow rate, and that is why medium sized bronchioles are there. This is the large airways, and over here 75 to 100 will be the small one, 0 to 25 will be the large airways. Okay, so that is your maximum mid expiratory flow rate. Another term that is there, which is maximum expiratory flow rate, not maximum mid, maximum expiratory flow rate. This is also called FEF, 200 to 1200 ml. Let's understand why it's called so. So you expire 200 ml, you expire 1200 ml. Okay, so between this, so when you're expiring after the first 200 ml to till you expire 1200 ml, that the rate over there, that is maximum expiratory flow rate. Maximum. Why is it called maximum? Okay, so remember the earlier diagram that we had talked about peak expiratory flow rate. The maximum peak expiratory flow is initially, soon when you expire. So that initial part where the expiratory flow rate is maximum, that is what we did here actually in that time between 200 to 1200 ml. So that is why it's maximum expiratory flow rate, also called FEF, 200 to 1200 ml. Okay, so I hope you understand. I'm not putting questions for this because it's all calculations and diagrammatic representation and stuff like that. Okay, so it'll be a little difficult to actually put out questions on this, but this is very, very, very important, because if you don't study this, it will be very important to very difficult to answer all these. Okay, so I hope you understood this. Thank you.